Hi, this is Dr. Johnny Nelson with Raleigh from the Bone and Joint Surgery Clinic, and this video is about the risks of shoulder replacement surgery. So the main thing to understand anytime you're having a conversation with your surgeon and with your doctor about risk, right, is it's not meant to scare you. It's only meant to make you fully understand that just with anything we do, including getting in a car and driving to see a doctor, there's risk with everything we do, and surgery is no different, right? And part of that, the decision-making process for surgery is to make sure those risks of the surgery don't outweigh the benefits of the surgery. And that's something that I will be talking to you about as we decide what to do for your shoulder. But this video is meant to tell you what the risks are of shoulder replacement surgery, and so you have a little idea of what those are. If you have questions about those specific risks, you can always ask me at that preoperative visit that we have. So anytime we make a cut in the skin, right, which a shoulder replacement surgery does involve an incision in your skin, there's always a risk for infection. The skin is your natural barrier against infection, so when we make that cut, there's a risk for infection. Now, as your surgeon, I do everything in my power to avoid that risk. That includes making sure your medical problems are optimized. So if you have diabetes, making sure your blood sugars are controlled and that everything is safe from a medical standpoint, but also from technique, including cleaning the arm very well during the surgery, giving antibiotics during the surgery, and also doing things in a clean, efficient, and also quick way help to bring down and minimize your risk. But anytime you make that cut in the skin, especially when you're putting in implants into a joint in the body, infection is a risk. It's a rare risk, and for every patient it's a little bit different, but it is a risk that you need to know about. The need for further surgeries. So say, for instance, you do get an infection in that shoulder, that may require that you have another surgery to clean that infection out. Or say, for instance, you have a shoulder replacement surgery and you fall and you break the components in there, that could require another surgery. So the need for further procedures. The other thing is understanding that shoulder replacement or any joint replacement does not have an infinite lifespan. So some joint replacement surgeries can, implants can over time have wear and tear, just like our natural joints have wear and tear, and that also could lead to the need for further surgeries down the road. Broken bones, right? So either after surgery, falling down and breaking your bone around the implants, or having broken bones during the surgery, right? So we use plates and screws and rods and things like that to replace your shoulder joint. And based on your bone mineral, your bone quality and other factors, sometimes patients are at risk for having breaks in the bone during surgery, and that is a risk that can happen during shoulder replacement surgery. It's a rare risk, and I do things like patient-specific planning to avoid those risks and make the best decisions on which implants to use, what sizes to use for them, but that is a risk that exists. Instability is a risk with shoulder replacement surgery. So the shoulder replacement, just like any joint, is kind of like a ball and socket, right? And instability, what that is that ball and socket, it comes out, right? That also is a rare risk, but it is a risk that can happen, and it may or may not require further surgery on the shoulder. So you have to understand that is a risk. Acromial stress fracture is a risk. So acromial stress fracture is a special complication that happens after shoulder replacement surgery, where especially reverse replacement surgery, if you're gonna have a reverse replacement, this bone here, the top of your shoulder and then the back of your shoulder blade, because of the way these implants are designed, there's actually slightly increased pull from some of the muscles around the shoulder joint. And that can lead to what's called an acromial stress fracture, which is not really a fracture, not really a broken bone, so much as it is like a bad bruise of the bone. So that is a risk after these surgeries, and usually is treated with a period going back into the sling. So you have to understand that is a risk of the procedure. Damage to nerves, blood vessels, and other structures around the shoulder is a possibility with shoulder replacement surgery. I spend a lot of time training in this technique and training on doing this as best as I possibly can, and also doing it very safely for you. But nonetheless, there's a risk for damage to those structures, either through cutting those structures or stretching those structures. So to replace your shoulder joint, we place it in a position that it doesn't usually get placed in. We have to really open that joint up. And sometimes nerves can be stretched beyond what they're able to tolerate and what they're able to be used to. And so sometimes those nerves go to sleep, right? The vast majority of nerve problems and blood vessel problems after surgery are only temporary, and they don't lead to lifelong deficits in weakness and sensation in the hand, but that can happen. It's super rare. If you do have nerve problems as a result of the surgery, usually it's a stretch injury. It's not that anything is cut, even though that is a possibility. And if it's a stretch injury, the vast majority of those will resolve on their own. They'll go away within a few weeks after the surgery, or sometimes a few months. So you have to understand that that is a risk of the procedure as well. That basically does it for the risks of shoulder surgery. As with any surgery, there's risks with anesthesia. So the anesthesia doctors will talk to you about the anesthesia risk, both the nerve block and the tube. With any surgery around a major joint, there's a risk for blood clots and things like that. So you have to understand that blood clots can form around a joint at the time of surgery. Again, very rare, especially in shoulder replacement surgery, and even more rare for those blood clots to cause problems like breaking off and going to your lungs. But again, that is still a risk. So you have questions about any of these risks, obviously you can ask me at your preoperative visit. Or give us a call. So hopefully this video was helpful, and we'll see you around at the Bone and Joint Surgery Clinic.